Thank you for joining us today. As on behalf of Integrated Health and Wellbeing Council, I'm Sukshim Sharma, and I warmly welcome you to this live virtual panel discussion organized by ISW Council in association with the AstraZeneca and the Rapid Global Cancer Alliance. Thank you so much, guys. Thank you for your time. This session is a part of a larger awareness initiative that's titled Bridging the Gap in Lung Cancer from Awareness to Early Detection and Timely Diagnosis. Lung cancer continues to be one of the leading causes of cancer-related mortality in India and globally. Yet, despite advances in science and medicine, it remains underdiagnosed and often detected late, largely due to limited awareness, delayed screening, and gaps in access to timely diagnostics. Through this digital platform, our objective is to bridge these gaps, fostering expert dialogues, knowledge exchange, and public engagement. Today's session, the focus will be on transforming lung cancer diagnosis and management, innovations in precision medicine. So that's largely what we're discussing today. Lung cancer care has evolved dramatically, from conventional one-size-fits-all approaches to highly personalized, precision-driven treatment strategies that integrate molecular diagnostics, advanced surgery, targeted therapies, immunotherapy, and precision radiation. Today's panel brings leading experts across medical oncology, thoracic surgery, and radiation oncology to share their clinical insights and real-world experiences on how precision medicine is reshaping lung cancer diagnosis and treatment. I'm delighted to welcome the distinguished panelists. I have Dr. Darshana Rane, a consultant medical oncologist at HCG Cancer Hospital, Mumbai, with extensive experience in precision oncology and advanced lung cancer management. Her work focuses on integrated molecular diagnostics and targeted therapies to improve patient outcomes. I have Dr. Karthik V, an associate professor of thoracic surgery at Tata Memorial Hospital, Mumbai, one of the leading cancer centers in the country. He specializes in surgical management of lung cancer and plays a key role in multidisciplinary evidence-based treatment planning. I have Dr. Vivida Dubey also, a consultant radiation oncologist at Nanavati Max Super Specialist Hospital in Mumbai, with expertise in advanced radiation techniques. She's committed to delivering precise patient-centric radiation care as part of comprehensive lung cancer treatment. Let us begin with understanding how precision medicine is reshaping lung cancer care across treatment continuum. So to start with Dr. Darshana, I would really like to know from a medical oncology perspective, how has molecular profiling changed first-line treatment decisions, if I say about lung cancer, over the last few years?
Hello. Thank you for having me here on this platform. And lung cancer still remains a very important cause of cancers and cause of mortality in India today. Definitely, our treatment has evolved and rather very drastically and in a good way over the past years. So when I was training, we had the basic chemotherapy as an only option. Then subsequently, the oral agents came into picture, the targeted agents, and here we are now. So precision oncology, what does that mean? It means that we find out what are the mutations that cause cancer. And we are really targeting these mutations by specific agents. These agents can be in the form of injections or tablets. And these injections are basically targeted therapy or immunotherapy. So these kind of therapies are novel therapy and has definitely added years and also quality in the patient's life. And previously, these agents were, imported, so it was a difficult access. Now, with the production in India, a lot of things have become very easy, economical, and easily, available to our patients. So, yeah, definitely evolved. Now we are able to precision medicine and precision oncology has enabled us to tailor the protocols into safer and something that can add quality as well as life to the patient. So definitely, uh, much improvement seen.
That's right, Dr. Darshana. Moving on to Dr. Karthik, I would like to know how has early and accurate diagnostic influence, surgical decision making, if I say in context to lung cancer today?
So, lung cancer, as rightly pointed out, is a global burden. So,
Right.
and it follows the principle of progression from early stage to a later stage, and especially the near non-small cell lung cancer, which is the most common type of lung cancer, has a good amount of what we call the lead time. So, it takes time to progress from early stage to late stage, which clinicians and researchers have identified that this lead time can be used for screening of lung cancers. So over the
Right.
past 2 decades, we have had huge screening trials that have focused on high risk people who are chronic smokers and performing low dose CT, what we call as LDCT, as aided in diagnosing lung cancer in stage 1 or even very early stage prior to that. And now we see 5 year survival of these patients who are diagnosed in stage 1 up and above 90 percentage. So this is what the West is holding, but the situation still in our country needs to be ramped up a lot, because we are still not able to roll out a LDCT program in India due to the associated economics. But surely we should plan ahead as a private and public partnership for rolling out a screening program in India.
Right. I think definitely we should plan ahead. I would really like to know from Dr. Vivida Dubey now that if we talk about radiations, how has precision radiation therapy improved the outcomes in this context?
So when we discuss about precision radiation therapy, it has somehow shifted the radiation planning from broad field radiation to a very precise and very concise radiation fields, which is now possible, and which has helped in improving the cure rate as well as local disease-free survival in patients. Also, with the modern techniques like 4D gating, motion management, which is now possible, it is more easy for us to delineate the tumor movement during different respiratory cycles. And accordingly, now we do not need to give bigger margins to our planning when we are able to see real-time tumor movement. So it is like with very small margins, very precise treatment planning can be done. And at the same time, the side effect to the nearby normal structures is hence prevented because now we are able to do a more precise planning as well as tumor motion management, which is possible. Also, with the advent of proton therapy, even in cases where the cardiac and pulmonary status of the patient was compromised, using the ability of proton therapy, which reduces the exit dose, even in these patients for larger volume tumor radiation, we can use proton therapy, giving us very good results for even such set of patients.
Right, absolutely. That's actually true. Dr. Darshana, would you like to add about, since we're talking about precision also and lung cancer care in the country. So I would really like to know about it. How do you individualize the treatment while we are talking about, balancing efficiency, toxicity, and quality of life as well at the same time? So how are we, let's say, customizing the treatment as per the individual and as per different patients, different treatment processes? So how do we do that?
So lung cancer basically, as my colleagues discussed, it is not just one type. It is, we have different types of lung cancers, and even in those in the types, we do a subtyping based on various tests, which are molecular tests, and they are specialized tests which are done usually on the biopsy that we get, but they can also be performed on body fluids, like the fluid which builds around the lung, that's the pleural effusion, or any other metastatic sites can be also evaluated. Now, it is important to understand that these tests take time to, come to us in the form of the reporting. So, in the meanwhile, we do start off with an therapy, which is, chemotherapy, or some, if we can get on the biopsy quick results on immunohistochemistry, then we can start on oral targeted agents. Now, based on not just the biopsy, but we also have to look into other issues, because lung cancer usually falls into not only young, but it can also present in elderly. So all those comorbidities we have to understand, like diabetes, blood pressure, thyroid, etc., and plan out a therapy. And we have today chemo, targeted, and immunotherapy. And immunotherapy is one such therapy. We need to understand basic, comorbidities associated with it. What are the autoimmune diseases that are associated with it? Because all these matter when we, formulate one therapeutic plan for that particular patient. Also in India, especially, we have to consider about financial status, which is very important. And hence, and thanks to the pharma, we have a lot of support programs which are pharma driven. So wherein, they provide few doses free or at subsidized rates for those who need. So all these are, thought about and incorporated while formulating a plan for our patient.
Absolutely. So different processes for different patients, and we are doing it for the different targeted age groups as well.
Yes.
Right. So, moving to Dr. Karthik, since we have lots of advances in the imaging, sector also, and minimal imaging techniques is something which is the buzzword right now. So, how has the role of surgeries evolved in this era?
Thanks for that question. So this question has two parts, as you said, the advancement in imaging. So
Right.
what was once CT scan was once the in staging investigation of soils probably 15 years ago. Now we have PET CECT and MRI, which are basic part of the staging. And this PET CECT picks up metastasis in one in every five patients. So there is a 20% change in the stage as well as the prognosis and treatment of these patients. And coming to patients who are curative, we have the latest kid in the block, AI, which has now been integrated into CT imaging. This has helped us identify and understand the anatomy, location of very small tumors, and helped us planning surgery very precisely. So along with this, there has been a penetration of minimal invasive surgery. So there are two aspects to this minimal invasive surgery. One is the thoracoscopic, and another is the robotic surgery. Both of these have significantly improved patient outcomes, reduced pain post-operatively, have had a positive effect on the pulmonary complication, and aided in faster recovery. And with the robo, we are even able to perform complex surgeries, and we try to save as much lung parenchyma as possible and only remove oncologically necessary lung, which was slightly difficult prior. Now we have made a very good advancement with respect to that.
Very well said, sir. As in, I think Dr. Karthik very well explained it that AI is also there now, and I think the hospitals and doctors and medical professionals are utilizing it to the max. Moving to Dr. Vivida Dubey, I would, since we are talking about AI now, I would really like to know what role does a radiation play in the whole process, and how are we using these, AI-driven systems in the process, and also please highlight about the accuracy part that is, very debatable in the whole context.
So, when we talk about AI and the modern techniques, so just like I discussed previously also, that now it is with the help of IR cameras and these modalities, it is possible during the radiation treatment time that we are able to see even in different respiratory phases how a tumor is moving. So we plan in each respiratory cycle of patient, with the help of these modern techniques, we are able to see tumor movement in all the respiratory cycles. We can plan tumor in all the respiratory cycles, and accordingly, even during the radiation treatment, we can modulate it somehow that whenever the tumor goes out of our treatment plan, the machine itself stops the treatment delivery at that point, so that there are less chances of tumor miss, and it is a more accurate planning. At the same time, when we talk about AI, so in radiation also using the AI and adaptive measures, even during radiation treatment of a patient, we are continuously able to monitor the tumor shrinkage, and accordingly we are able to change our tumor volumes. We are able to reduce the tumor volume so that the areas where the wherever possible we can reduce the side effects of radiation, and at the same time more precise and high dose precision can be delivered to the tumor. And because of these modern techniques and modern planning systems, we are able to go for dose escalation at the same time, not hampering the nearby structures and also not hampering the quality of life for the patient.
Right, I think absolutely. Since Dr. Darshana mentioned about the targeted therapies and how we are formulating and customizing the whole process, there must be some challenges also in the process, ma'am, right? Please throw some light on that. The challenges that you see, ensuring timely molecular testing also in real world, if I say, and how can these be addressed?
Yes, that is a very important question because we have a lot of labs. During the COVID, we saw a lot of these NGS labs, come into the picture, and so it is very difficult for us also to choose which one is best, because all matters is the quality of how they report, and also the cost. It should be cost effective, and also the report should come on time. It should not be a very delayed report. So all these matter, and these are some challenges that we do face. We also have a few labs which are doing local panels, as in trying to develop new these genetic gene panel within India itself, and that is going to really help in a long way, because to see what our Indian population has and all, so that is something will be a part of a research as well. We need better and cheaper tests available, definitely, and maybe the government can think on those lines as well. And we have, again, the labs also are having these coupons which we use to give similar tests at a subsidized rate, and limited panels to be done. So all these things are being incorporated.
Right. I think moving beyond the challenges, Dr. Karthik, can you please help me understand like how multidisciplinary tumor boards help determine which patient truly benefit from surgical interventions? Is there any process in a line? Can you please educate us on that?
So, multidisciplinary boards are at present the norm, and they are not the exception. So, every patient who is being diagnosed and treated and even followed up needs to be taken care by a multidisciplinary board. The multidisciplinary board is a multifaceted group. It includes eminent, not only this panel, apart from the surgeon, radiation, and the medical oncologist. We are even going to have physiotherapist, pulmonologist, and we are going to have radiologists, pathologists, who are individually trained in thoracic cancers, diagnosis, treatment, and as well as management. So these specialists try to get the best fit for the patient. So this is not only for surgery. So whenever I get a patient to my multidisciplinary radiation oncologist, see to that this patient gets the best possible treatment, which might include, along with my surgery, also chemo and immunotherapy. Or if I feel the patient might not be benefited from surgery, I call the radiation oncologist into the picture, so where they can provide the best possible treatment for the patient. So we are all not competing with each other. We are all complementing each other. We are like horses pulling the same chariot, so that we reach the goal as fast and as safe as possible.
Absolutely. This is about talking the boards that are involved in the process. Dr. Vividha, moving with this thought only, I would like to know how advanced planning techniques also, plays a role in this process. Be it image guided radiotherapies that are changing treatment, but what about the accuracy factor in the process? So boards are there, we have different policies in place and the advanced technologies. But how is it all, changing the treatment and the accuracy part also?
So when we discuss about the advanced technologies, the image-guided radiotherapy, these all techniques involve, along with the planning, daily on-board imaging, which we term it as. So daily, even before starting radiation of the patient, image is captured on the couch itself to see for the tumor location as well as patient positioning, to even minimize or avoid millimeter of error also. With tumor tracking and with motion management, 4D gating, it is possible even to avoid a millimeter of error also, which can happen, which was previously done in a blind method. Now we are able to look into it and even capture these images and to minimize even small chances of error, in fact.
Right, absolutely. That was insightful, ma'am. Dr. Darshana, you talked about the oncology perspective also, how we have evolved and how we are utilizing this evolution and customizing the process of treatment for patients. Looking ahead, what do you think? Which emerging biomarkers or treatment strategies that you believe will help the biggest, bring the biggest impact on lung survival? If we talk about lung cancer, what will be helpful for the survival part?
So this is again linked to my previous thing. We need so most of the panel that we are offering right now are limited panel, and these limited panels are usually dependent on what treatment options are available, or what clinical impact the genetic mutation is having on the cancer outcome. Now, going further, as we come to know about more and more mutations which can be targeted by specific agents, once these specific agents are easily available in India, and that too, if they are manufactured in house, the generic versions, they will be something more helping with the significant they're working significantly with the improving survival, because right now we know that there are medications available, but we are not able to imply just because they are not available and they're exorbitantly expensive. So sometimes with time we know that more and more of these molecules are now made easily available in India in a generic way. So yeah, so that is
Is
something.
affordability also, taken care of during
Yeah,
this
so that's
process?
what I meant to say. When they are made locally and in a by the generic versions, so not the original molecule. So with the generic versions are more. I mean, they come at almost 1/10 the cost. So the
So they're accessible also.
so they are very accessible, very easily available, and also we do have a lot of support programs also available on them as well. So it has become a boon in that sense, and we just want to hope that this is helped by the government as well. Uh, because these are some things that need to happen in a timely fashion, because as and
Absolutely.
when new drugs is coming into the market, and if we don't have innovations happening here, we lose the time at which we can treat in a more effective way.
Absolutely, absolutely. I think time is key in this context when we're talking about lung cancer treatment. Also, moving to Dr. Karthik, in your experience, since Dr. Darshana talked about the timely intervention also, that be it the policies, be it the government, or be it the private sector, we should be aligned in working towards one goal, that time is saved. Talking about time, do you think that what should patients understand about the role of surgery that is happening in early stage versus the advanced lung cancer, which has already crossed the first stage, second stage, and it has come to a point that we have less time. So please throw some light on that. That what should patient understand about the role of the whole process?
So, as you said, there are three facets to these stages. One is the early stage, then we have the locally advanced stage, and then we have the metastatic stage. So, the spectrum or the role of surgery in each of these stages is already established, but they offer different spectrum of. We offer different spectrum of surgeries in these three stages. So, early stages surgery, I would be offered that as a forefront treatment for all the patients, because that is going to establish the cure and also properly stage the patient with our surgery along with the lymphadenectomy. So that will help us also in delivering the adjuvant treatment wherever it is needed. So now we have both adjuvant immunotherapy, adjuvant targeted therapy also in this space, where patients who undergo upfront surgery for early stage, appropriately stage in very specific conditions, we offer them. And locally advanced stage,
Yeah.
so which
Right.
is this locally advanced and the metastatic stage. These are the common stage in which patients still present in India. Close to 80% of the patients present in these stages. What was previously very dismal, with even locally advanced stage, the survival has now significantly improved. Now, with the advent of precision oncology, now we are able to deliver chemoimmunotherapy and then offer surgery in locally advanced select group of patients from 2B and 3A, where the we have seen now with three randomized trials where they have shown survival benefit of using neoadjuvant chemo and immunotherapy. With respect to, and also now we have ongoing trials addressing targeted therapy in patients who are having molecular mutations positive, where prior to surgery we are offering chemotherapy with the targeted therapy or targeted therapy alone, then followed by surgery to maximize the survival benefit. With respect to metastatic setting, so systemic therapy would be the forefront based on whatever the molecular marker is available, but we still have scope of surgery even in metastatic setting, as if there is something called a limited metastatic setting, what we call as oligometastatic setting, where after systemic therapy we consolidate the patients by offering doing surgery and curing these patients. And patients who have disseminated metastasis, those who are undergoing systemic therapy or targeted therapy, after prolonged systemic therapy, if there is any one single site of residual disease, surgery still can be offered to these patients to improve their survival. So surgery
Right.
has its role in early stage, the locally advanced stage, as well as in metastatic state. This is supported and strongly by the my systemic therapy options.
Doctor, are we also doing anything in the context of awareness also?
Uh,
Any particular specialized counsel that we're giving to patients, counseling, or any kind of, let's say camps or anything in this regard to spread awareness?
So the main awareness will be what in our setup when the patient comes. We the most important thing is to stop usage of tobacco. So that's going to be the important first step of any patients who has been diagnosed. If they are tobacco or users or smokers, that is the first support that we are going to give to them, along with the diagnostic and treatment options. With respect to awareness, government is propagating the national tobacco control program, and trying to spread awareness of tobacco limitation. With respect to lung cancer awareness, at present in the public sector, we are yet to launch camps to promote awareness. So if such camps are available, I think either Dr. Darshan or Vivida can surely enlighten me.
I
Yeah,
think
so
we are doing one. Yeah, please.
yeah, so definitely, the government camps are not available. That is for sure. But tobacco and the newer version of the smoking, that is the vaping, is something that is causing this lung problem. As well as it is important that we create awareness even into the farmers, because the way they use a pesticide without any personal protective equipments, they just put put some cloth on their
Mask, but
face,
yes, clothes.
the cloth on their face, and they don't use a mask, or even though the skin is all exposed, with the bare hands they are spraying. And so that is also something that we need to know. um, Smoking can also, smoking is not just the person who's smoking, but it's also the passive smoking, that is a
Right.
smoke which is liberated in the general environment. And the people who are along with the smoker, in most of the context, is the family. And family includes the women and
Even
the
the
children.
kids.
In the children,
Absolutely.
the women and the children, so they all are affected by this kind of a thing. So in my setup, we do have these camps and these awareness programs. I usually conduct a lot of awareness programs to a lot of industries. Usually it's a webinar based now, but physical camps also include. Though, as Dr. Karthik said, we don't have the facility for low dose CT scan yet, but definitely, to make sure that whoever is smoking stops it. And with whatever little symptom that they have, they should get themselves evaluated by the clinician, and not consider it as some non-specific cough or something, and take a timely intervention
What
before
can be the
we.
symptoms also, doctor? Can you please elaborate on that also?
So it can be a nagging cough, a persistent cough, that I mean, blood in the sputum. So having blood in sputum is not a very common thing, but it's a very specific thing that on the thing. It can present with chest pain, and this just chest pain usually worsens at night. And difficulty, I mean, there is also some shortness of breath that one may experience suddenly, like they are walking, and then with the past few weeks, they are finding that they're not walking with that energy. They're having breathing shortness of breath, and so on. They cannot climb a flight of stairs. So, in India, most commonly after nutritional deficiencies, this could be one of the reasons one should keep in the back of their mind, that this could be one reason. And definitely, the most commonly people present to us with a late stage, when the cancer has already spread. So usually there are metastasis, and the metastasis usually are to the liver and the bones. So they present with bony pains. They can have jaundice. If that goes to the brain, then they have headaches or convulsions, and so on. So all these things need to be evaluated in a timely fashion, because as Dr.
Absolutely.
Karthik said, even in the oligometastatic, when there were less than there are very few sites which can be targeted by either surgery or radiation therapy, we can still offer cure in lung cancer as well. So that is something that we need to understand and work on.
But I think for that, we need to be aware, and we need that, timely diagnostics also in place. That's right. Moving to Dr. Vividha, since we were discussing awareness, from your perspective, I would like to know that, how can awareness about the modern radiation therapy also help reduce the fear and the misconceptions about, among the patients?
So when we talk of radiation therapy, the first thing that the challenge that we face is the fear amongst the patient. Where does this fear comes from? Number one, some misconception from outdated techniques, say 20, 30 years back, mostly from shared stories from people who have no knowledge of what radiation therapy is. And also from somewhere they come to hear about some misconceptions about radiation. So they do not actually know how radiation functions. And because of these fears, usually patients sometimes they miss out on radiation therapy when advised early and then later come up with advanced stages. To overcome these fears, it is very much important that first we need proper counseling of patient when they come for radiation regarding what the newer techniques and technologies can offer to them. If this is solved, then half of their problems are sorted out. Also, once they know that what all modality, it is a shared information with them that what will be the daily process before starting the radiation, during radiation, what are the possible side effects. If all these things are discussed with patients in detail, probably they are more than compliant for treatment completion. Also, one thing that plays a role is survivor shared stories. Many a times we some patients who are still not convinced, we ask them to discuss and know about the treatment with some other patient who have already undergone radiation so that they get to know one-to-one experience of how patient uh, who has already completed radiation, what was the side effects and all these things that patient face, so that they get more confident that whatever misinformation they had, once those are sorted out, they are more confident of completing their treatment.
I think absolutely well said. Since we are moving towards the conclusion of the discussion, I would really request all of you to, if there is one message that you want to give to the patients who are suffering from, the lung cancer, and from, for the caretakers also. Since I think, in my knowledge, they need to be aware first to support the patients as well in the process. So please throw some light on that, and the last message that you want to give to them. I'll start with Dr. Darshana. Yeah.
So for me, any symptoms that one has, one has to get it evaluated. Don't get bogged down with what people say, because each patient has a different journey in the cancer, and each cancer, as we now know, has got a tailor-made treatment. So your treatment can be different from your other patients who's because most of these misconceptions are spread via hearsay or via the WhatsApp or some internet story. So it is best to have information from the healthcare provider rather than all this. Also, stop tobacco. Tobacco in any form is bad. No vaping, and be safe when in workplaces, and even to our farmers. The fields which they spray, the kids are running about in the same time when they are spraying. So all these small factors, they are something that has to be understood, and personal protection has to be the key.
Absolutely. Dr. Karthik?
Yeah, so with respect to the message that I want to convey, so as already pointed out, if you are a smoker or you are a secondary smoker, do stop smoking, or make whoever your colleague is there to to stop smoking, and then not to be afraid. We are all here in this journey with the patient to offer best possible treatment and outcomes. And we have very good regional cancer centers, so patient doesn't need to travel a long time, waste valuable resources. They can all go to cancer centers of their respective states or districts where they will be offered treatment on par of any best centers in India. And as already pointed out, please do not fall for any misconception. Be it early stage or late stage, we have very good treatment options which not only reduce your symptoms, they also improve your survival in the current scenario. So do not fall for misconception. Please do consult an expert, and the same expert opinion can be obtained as close as to your home in the current scenario.
Absolutely well said, Dr. Karthik. Vivida, you want to add?
Yeah, I would like to add that the first and most important thing for patients is early symptom awareness as well as early detection. Once they know that the earlier the symptoms are diagnosed and the earlier the cancer is diagnosed, the better treatment availability and opportunity is available for them. And also they need to be aware that regarding all the recent advances and techniques and technologies in precision oncology that have come up, that has improved the patient survival as well as have given better quality of life to patients.
Absolutely.
To be certain centers equipped with psychological counselors who can provide at the same time counseling to the patient as well as caregivers also regarding all the future uncertainties that sometimes patient or the caregivers have. They can at least have some third person with whom they can discuss in detail regarding their concerns.
Absolutely. Well said, Dr. Vivida. I think, thank you so much, doctors, for all the valuable inputs and insights. I think you all truly, made us aware about all the factors that should be there, and we should consider it as caretakers also and as patients in the society also. Today's discussion, highlighted the precision medicine. It's not a single treatment, and it is a coordinated approach. That's what we discussed today. And as lung cancer continues to evolve, early diagnosis, molecular testing, multidisciplinary planning, and patient-centric decision making, I think, will help the pillars for the better outcomes. So, on behalf of ISW Council, I once again thank you all for taking out time and being the part of this discussion. Thank you so much, doctors. Thank you.
Thank you.
Thank you so much for
Thank
having
you.
us.